Um, Welcome to this press conference on how CARES Act money was distributed in the 5th Congressional District. I appreciate your joining the call. I just flew back to Washington, D.C. last night, got back about 1 o'clock in the morning because the plane was late. This morning, the biggest issue in Washington seems to be whether or how we extend CARES Act funding. I will give you an overview in this press conference to start with, and then we will hear from 5 different types of recipients of the CARES Act funding. First, let me give you some of the caveats with the data. These are evidence-based estimates and are to the best of our knowledge. This info is not in one place and was very hard to dig up. It was not easily or publicly available. Kara Ince on my staff deserves tremendous credit for doing the digging, and we are happy to provide the basis for these numbers. There's a downloadable spreadsheet that goes into some detail, and it could be obtained at Kara, C-A-R-A .ince, I-N-C-E, at mail.house.gov. That's Kara Ince at mail.house.gov. I think there's a certain symmetry that the CARES Act funding was dug out by a woman whose first name is Kara. Another caveat is these numbers are changing all the time as we get more information. This was a project that has literally taken weeks and a couple of months. Another caveat is in some categories we know the District 5 numbers that we'll be getting additional funding from CARES, but we don't know how much yet. And this is especially true for funding that's channeled through state agencies because there's a certain delay in receipt. And then finally, if anything, these are underestimates. So the press advisory said that it's about $1.2 billion. The way we will calculate these numbers today, I think we can show this to you, it's more like $5 billion. And that's money received so far just from the CARES Act. As I say, the big debate in Washington right now is whether and how we extend it. I've already voted for the so-called HEROES Act. We did that 2 months ago, which was much larger than the CARES Act. Mitch McConnell is offering something like $1 trillion today, or a third that amount. So this is literally the biggest surge in federal aid in US history. The virus sets the timetable on spending. But this is an amazing, large amount of money. The urgency is incredible, and the first slide will be about the urgency. The most predictable crisis we face is the end of the $600 federal unemployment benefit, which has literally been a lifeline for countless Tennesseans. That doubles or triples the maximum state benefit of only $275 a week. That extra $600 per week has literally been a lifeline. So how do the numbers break down? The following charts will give you an overview of it. If we could move to the next slide. You see here that direct assistance to individuals in the 5th District has been about $1.2 billion. This is primarily in 2 forms. This is in forms of the stimulus check of $1,200 per month, plus an additional $500 per child. But also it's been in the shape of the extra unemployment benefit, the extra $600 per week, which of course for a month is $2,400 per month. Another huge category has been medical service, training, and emergencies. That's some $300 million in the 5th Congressional District. Emergency government response is $239 million for various levels of government. Schools and universities have received some $85 million. And then there are other categories, including indirect assistance and emergency research. So you can see here in this chart, the vast majority of CARES Act funding, $1.2 billion of this initial tranche has gone to individuals. Next slide, please. This shows the breakdown of PPP loans, and it'll be followed by a slide for EIDL loans. PPP loans, of course, were designed to keep people employed, to keep people on the payroll. And these are distributed not by the government, but through commercial banks. And the 5th District has some 70 plus commercial banks. So the aggregate amount for Tennessee's nearly $9 billion. And our district, if we could go back a slide, Katie, if we could get back a slide, the aggregate amount just for the 5th district has been somewhere between 1.3 billion and 2.6 billion. We don't know the exact numbers because it's distributed through some 70 commercial banks. So that's the PPP program. Another vital program, if we could go to the next slide, is the EIDL program. And that's distributed through the Small Business Administration. And as you can see, the number for Tennessee has been 1.7 billion. We are estimating that the Tennessee 5th district estimate is something like $200 million. But that could be a dramatic underestimate because the 5th district is the hub for commerce for much of the state. So in aggregate, if you're keeping score at home, these are huge numbers, and in aggregate, they total pretty close to $5 billion. So now we will hear from individual speakers who represent organizations that are recipients of this money. And then the final speaker will be a guy who's actually been on unemployment himself and knows the meaning of that $600. So the first speaker will be Amy Frogge from the Nashville School Board. Amy, turn it over to you.
Good morning. Thank you so much for inviting me to participate this morning. Metro Nashville Public Schools recently made the difficult decision to start virtually this year. As an MNPS parent myself, I know personally how critical it is for us to keep our children and our teachers safe during this time of increasing coronavirus cases in Nashville. We must prioritize the health and safety of our school communities and our children first and foremost. MNPS did not have enough computers for an effective virtual opening. So Mayor John Cooper worked with Director of Schools Dr. Adrian Battle to direct $24 million of the city's CARES Act funding toward our technology needs. Now, every public school student in Nashville will have access to a computer and an internet connection this fall. In a chronically underfunded school district, which regularly does not have enough funds to even purchase textbooks, this was an amazing feat. We are thankful that our mayor was willing to make such a deep investment in Nashville schools. In addition, Nashville schools received $26 million in CARES Act funding, $2.5 million of which was diverted to private schools. Here is how Metro Nashville Public Schools is spending our remaining CARES Act funds. We are utilizing $10 million to feed hungry children throughout our school district and to fill the nutrition gap created by the unexpected closure of schools this spring. MNPS is using some of our federal dollars to creatively address other needs, such as access to a virtual learning curriculum, to purchase pre-K manipulatives for children to use at home, and to buy music supplies for students this fall. And if school districts in Tennessee are to reopen safely at some point, it will be vital that we have adequate funding to do so. Guidelines for school reopening will require a substantial investment in our school facilities, in personal protective equipment, and in cleaning and sanitation supplies. Between now and December, we expect to spend $6 to $10 million in CARES Act funds just on PPE supplies. As a community, we must come together to ensure that every child is protected and ready to learn. Sufficient funding is the first step toward this goal. The coronavirus has laid bare the stark and vast inequities in our school systems, and the needs of our families and students are so immense that MNPS has utilized every penny of federal funding in order to operate effectively during the pandemic. While we are deeply grateful for the federal funding we have already received, we remain aware of the deep and pressing needs of Nashville's most marginalized students that are served by our public school system. We will continue to try to ensure that every child in Nashville has a productive and healthy school year. Thank you.
The next speaker is it's Katina Beard from Matthew Walker Comprehensive Health Center. Katina, turn it over to you.
Thank you. Good morning, Congressman, and thank you for the opportunity to be here today to speak about what the CARES funding has done for us. As a background, Matthew Walker is a federally qualified health center with sites in Nashville, Smyrna, Clarksville, and we have a mobile unit. And annually, we are seeing about 17,000 patients with about 54,000 visits a year. And that includes our medical services, dental, pharmacy, radiology, lab services, case management, and social services. And we employ about 130 employees across the organization. And so this funding was vital to us because our patient population is about 55% uninsured. And so without our patients and our revenue, our health center would struggle at all the community health across the state. So we received funding 3 different times, which were just very incredible times for the organization. And our first funding was received in early March, and that allowed us to increase our purchasing of cleaning supplies, our PPE, and to improve our digital environment to be able to have our Zoom meetings and to be able to provide telehealth for our patients. Our second thing came in about April, and that was just over $1 million. And that allowed us to continue providing our staff, maintaining our staff. And so throughout this pandemic, we have not had to lay off or have any of our staff be unemployed due to this funding. We've been able to maintain our staff and all of our services. We will also be renovating a very small portion of our Nashville location to increase access to care, and that will allow our staff to have proper social distancing. The third funding that we received was in May, and that was just about over $350,000. That allows us to increase our COVID-related testing. And we've been doing that in conjunction and partnership with other community health centers like Connect Us, partnering with our faith-based organizations in the communities, providing community-wide testing, follow-up to patients, to residents that have received the testing. And so this funding has been very useful and timely, not just for our organization and our staff, but for our patients, because we've been able to continue to see our patients. Our patient volume has not decreased, except for maybe the first 2 weeks of this pandemic. And we've seen our numbers increase. And we see ourselves as a gatekeeper to maintaining a system of care for individuals that will keep the hospitals treating the patients that need them the most. And so we're keeping individuals out of the hospital, and this funding has allowed us to do that. So we appreciate your work and your efforts in this, and we appreciate any ongoing support. Thank you.
Thank you so much, Katina. Our next speaker will be Juliana Espina-Cano with Conexion Americas. Juliana, it's all yours.
Good morning, everyone. Juliana Espina-Cano with Conexion Americas, and thank you for allowing us to be here this morning. It is truly an opportunity to discuss what many of you have shared in terms of this disproportionate impact of COVID-19 in the Latino and immigrant origin community. Conexion Americas is the largest Latino serving organization, nonprofit in the state of Tennessee. And we typically see about 9,000 people on an annual basis. But with COVID-19, we're seeing an increased number of folks and people that are coming to us for assistance. Conexion Americas received PPP funds through the CARES Act at the beginning of April. And as many of you have shared, that allow us to not only retain our staff, but cement our work in guiding families through these very, very difficult times. Since that time, we've been able to retain all of our 49 colleagues and pivot our work to provide specific information, resources, meals, and guidance to non-English speaking families and immigrant origin families throughout the state. To date, we've been able to distribute over 4,000 boxes of food, in addition to financial assistance to the families that unfortunately did not qualify under the CARES Act. So even though we recognize that a significant portion of the population was taken care of through the CARES Act, unfortunately, many of the families that we see did not qualify for any type of assistance. Therefore, we were able to advocate on their behalf and find other resources to help those individuals. In addition, Conexion Americas, as many of you know, is located at Casa Azafran, where we have other 8 partners, nonprofit organizations, many of them who also received CARES Act funding that have been able to also step in and provide services either related to legal work or health resources and information, specifically Neighborhood Health Clinic, who is an organization that is clinic located at Casa Azafran. Now we're concerned about August and what is coming our way as the provisions and assistance ends for many of the families. So I'm looking forward to engaging in this conversation as we think about the future and conversations related to the HEROES Act, as we know that this particular provision will be able to cover many of the families that were not part of the CARES Act. But to close, I would say that we are grateful because the CARES Act allowed us to continue doing the work that we do and supporting families who were not part of the initial package by providing advocacy and resources in the community. So thank you for the opportunity, and I look forward to the conversation.
Barbara Tharpe from Meharry Medical College.
Thank you. Good morning, Congressman, and thank you for the invitation. I'll be speaking about the CARES Act as it relates to colleges and universities. For the CARES Act, in order to receive those funds, Meharry had to certify that we would comply with the CARES Act. The CARES Act provided nearly $14 billion to higher education students and institutions. Allocations to specific colleges and universities, it was weighted considering an institution's number of full-time Pell eligible students. Meharry is a health profession school who enrolls medical, dental, public health, and researchers, and we do not receive Pell Grant funding. Therefore, our allocation was maxed at $109,988. The CARES Act Higher Education Emergency Relief Fund, it provided short-term funding to all institutions to provide those emergency financial aid grants to students whose lives had been interrupted or disrupted and facing financial challenges and struggling to make ends meet because of the COVID-19 pandemic. Meharry's student population is comprised of a diverse group of students. Our enrollment is approximately 900 students from all walks of life. All of our students are independent and most receive little to no support from family members. Therefore, scholarship and grant aid funding, they're significant and go a long way in helping to reduce the loan indebtedness of our students. The current student loan indebtedness for our medical and dental students averages over $300,000. The CARES Act funded provided some relief to a small group of students who were impacted by this pandemic and did not have the support of family members to assist with increased costs due to the shutdown. Based on the number of students that were enrolled at Meharry and the amount of funding we received, we decided to use the first come, first serve approach to determine what students would receive funding. We created an application and sent it to the student body. We had a committee and the students submitted their documentation along with that need. However, we were able to assist 121 students based on their requested critical need expenses, such as help with rent, utility, technology needs, and food. The students expressed gratitude with the assistance received from the CARES Act. However, Meharry remains committed to pursuing additional funding to assist our students and the entire campus. Thank you for your continued support.
Thank you. Our next speaker will be Steve Boyle. Steve, turn it over to you.
Can you hear me now? Thank you. Thanks for inviting me here. On a personal side, I wound up dealing with unemployment, which was a bit of a surprise for me since I haven't been on unemployment since I was in my 20s. When the pandemic hit in the beginning of March, I was lucky enough to keep working at home, but by the end of April, that was done. So I signed up for unemployment, and as much as I know that they're swamped there in unemployment, I needed to get some answers because I wasn't too sure if I had answered all their questions and delivered paperwork correctly. So I started asking questions and received bots for responses. This went on for weeks, and after a while it was adding up to about 2 months, and I was trying not to panic at that point. I discovered that my brother, who lives in New York, was going through the same thing. He had found out from a coworker to contact his congressman, and he did. And shortly after that, he heard from unemployment. So with that information, I did the same. I called Congressman Cooper's office on Friday, left a message. Monday, I heard back with a phone call and an email asking me about my situation. I was asked to write a report on it. I delivered the report on Tuesday. Wednesday, I received a phone call and an email from Congressman Cooper's office again to confirm that they have talked to unemployment. 8 days later, I heard from unemployment, which was more than a relief considering I was wondering what was going to happen at the first of the month. So this was a big deal for me, and information that I just lucked into. Most people don't realize that their state and federal representatives can represent them on situations like this. And so Congressman Cooper's office was great in getting me to this lifeline of $600 a week unemployment stimulus. Without it, I would definitely be in trouble. And the fact that it's now being questioned on whether it's going to continue or not is a whole nother situation. All it does is get me through the month. And that's just someone like me. I'm a single guy. I'm divorced. My kids are grown. My brother is married with 3 kids at home. I'm not sure how he does it. But to mess with it anymore would be catastrophic for us middle class folks. So I am here also to implore the Senate to please continue the $600 a week unemployment status, because without it, it's total catastrophe out there, I feel, in my opinion. It certainly would be for me. Thank you very much.
Thank you, Steve. That was very powerful testimony. Thank you. We will turn it over now to questions. Remember, this is one of the largest, if not the largest aid package in U.S. history. The 5th District has received on the order of close to $5 billion. We want to make sure that people are protected. In so many cases, this aid is absolutely vital for survival. Why don't we turn it over now to questions? And remember, if you want details on this, we can send you a downloadable spreadsheet of the details. If you go to cara.ince, cara.ince @ mail.house.gov.